tandem heart. It is a percutaneous centrifugal pump. The inflow cannula is placed from the femoral vein and it goes into the right atrium and punctures the septum and goes into the left atrium. The outflow cannula is in the iliofemoral artery. It significantly reduces the preload and improves the cardiac output. The pump flow typically is up to 4 liters per minute, and fluoroscopy and TE is very important in guiding the catheter across the atrial septum. Here you can see the femoral vein and the femoral artery. To the femoral vein, the catheter is passed and the sheath goes in. Now it is very important. This is the inflow cannula. It punctures the septum and goes into LA, and the blood comes into the tandem heart and it goes into the outflow cannula, and this outflow cannula goes via femoral artery into the aorta. That is very important. So, LA is the inflow and the femoral artery into the aorta is the outflow, and this is an extracorporeal centrifugal pump which rotates around 7500 rotation per minute. This is the tandem heart left ventricular assist device. Cardiac tamponade can be a complication which can happen with 1% of transeptal puncture. The migration of inflow cannula from the left atrium to right atrium can lead to hypoxic blood being pumped into the outflow cannula. The LA receives blood after oxygenation, but if the cannula from the LA goes into the right atrium, there is deoxygenated blood which comes into the right atrium, and this cannula receives the deoxygenated blood which goes into the systemic circulation, so there is going to be hypoxia. That is very important. It is imperative to maintain the LV ejection and opening of the aortic valve. This is done to prevent thrombus formation in the left ventricle and the aortic root. In the previous animation, you could have seen from the blood from the left ventricle going into aorta through the aortic valve. This small amount of LV ejection and opening of aortic valve is very important to prevent the thrombus formation. Another important thing is adequate RV function is critical to maintain the blood volume delivery to the left heart to achieve adequate systemic support. That is very, very important. Your RV function should be adequate. The iatrogenic atrial septal defect, which is created by puncture of the atrial septum, typically closes within 6 months but can remain open even after 12 months in 7% of the patient. Hemodynamic support is better than IABP, but more complications are observed because of highly invasive nature. The FDA has approved it for the use of around 21 days, that is 3 weeks. The contraindications to placement are ventricular septal defect and moderate to severe aortic insufficiency. Anticoagulation is necessary in tandem heart placement.